Okay, welcome everyone. Thank you so much for joining us today for this webinar focusing on an inclusive response to COVID-19, ensuring education for all. My name is Charlotte Bergin from the Interagency Network for Education in Emergencies. Before we get started with today's webinar, I'm just going to review a few webinar housekeeping things with you, as you can see on the slide. So firstly, just to reassure you, participant audio and video are disabled, so don't worry, we can't hear you or see you, so don't worry if you're making noise. Also, just a reminder, you can post questions using the Q&A function at the bottom of your screen anytime, and we encourage you to do that. Our panelists will respond to the Q&A in writing and during the discussion at the end of the webinar. Also a reminder that the session is being recorded and the recording will be shared widely afterwards. English closed captioning is available. Again, you see that at the bottom of your screen, and international sign interpretation is also available. The recording and all of the presentations will be shared on the INE website after today's session, so please do share that with your colleagues. And please do join us on Twitter. You can see the handles and hashtags there for you to use. But welcome everyone today. This is the 20th webinar that we have done as part of INE's COVID-19 webinar series. And we know that during that time, you have all been working tirelessly to continue education provision in incredibly challenging conditions. We're excited for the 20th webinar of the series to be able to focus on such an important topic that we know means so much for our members. If we could just move to the next slide, please, Andrew. Thank you. So this, back in April, we held 2 webinars focusing on inclusion, this important topic, but we're really glad to today, a few months on now, we can share further tools, further evidence, further resources to support colleagues, as we've heard throughout the pandemic that issues of inclusion and equity have been real concerns for many of you across our network. And so hopefully today we'll be able to provide you with more support as you continue your efforts to support all learners in the short term during the pandemic, but also as we think about trying to build back better in the longer term. I just want to also pass on a welcome on behalf of Dean Brooks, our director at INAE. But he's so grateful for you all being with us and for everyone who has participated in previous webinars, and again wants to recognise the incredible work that the EIE community have been doing at this time. I'm going to keep my comments brief because we have a packed agenda today, a really fascinating range of speakers. And so if we just go to the next slide, I'll just give you a very quick overview of our agenda. So we're going to start with an overview and framing from our colleagues at the GEM report, who recently published the 2020 report focusing on inclusion. We'll then be hearing from our colleagues at the World Bank who will be sharing recent evidence and guidance from their leveraging lessons from the COVID-19 crisis for learners with disabilities. We'll then hear from our colleagues from Lebanon, from Humanity Inclusion, who will share really practical examples of how they've been doing this in practice. We'll then hear some guidance from the Girls Education Challenge, who've been doing some focus work around tackling dropout and getting girls back to school amidst the pandemic. And then we'll have 2 more practical field examples. And we'll hear from World Vision in Zimbabwe, and we'll hear from CARE International in Somalia. And to finish, we'll be hearing some reflections from Dr. Joseph Murray about what the lessons we can learn and how we can build back better beyond the pandemic to transform education systems to become truly inclusive. So I think you'll agree it's a packed and fascinating agenda today. We'll then finish with our 30 minutes Q&A, so please do keep those questions coming. And if we just go to the next slide, you can see here the fantastic speakers we have. So you'll have me from INAE, and you'll be hearing from Anna Dadio at UNESCO GEM Report, and Anna Martin from the World Bank. You'll then be hearing from Henrietta Chidiak from Humanity Inclusion in Lebanon. We'll hear from Michelle Lewis-Sandal from the Girls Education Challenge and UK Aid. We'll hear from Mbuso Jama from World Vision International Zimbabwe, and Mohammed Diat from CARE International Somalia, and last but not least from Dr. Joseph Murray from the International Disability Alliance and World Federation of the Deaf USA. So thanks to our panelists for being with us today. I'm going to hand over immediately to Anna from the GEM report to start us off with an overview and framing around inclusion in COVID-19. Thank you so much, Anna.
Thanks a lot, Charlotte. Thanks everyone for having me here. Before starting my presentation, I would like to show a short video that will show some of the main messages of the Global Education Monitoring Report of this year on inclusion in education. Andrew, please, can you show the video? Thanks.
Everyone is different. The 2020 Global Education Monitoring Report on Inclusion and Education believes that education is strongest when it embraces diversity. Learners should not have to adapt to the system. Instead, education systems should adapt to their needs. When students do not feel welcome in school, they are less likely to learn. This is everyone's loss. But rich and poor countries too often educate some children apart. Children who have a disability, have been displaced, speak a different language, or are poor and disadvantaged. School design may favor some students over others, as do many laws and policies. Teachers are often ill-equipped to cater for students' diverse needs. Children may not recognize the way they are portrayed in textbooks. Some may not see themselves there at all. They receive the message that they do not belong. Testing sometimes follows a narrow vision of education, and consequently, some students leave education earlier than they should. These are complex problems to solve, but a belief in the right to education is a belief in inclusion. Children have different learning speeds and needs. They need curricula that are flexible, creative, and relevant. How we prepare teachers matters. They must be given the tools and training to achieve our vision for reform. The resources we know can help the marginalized, educators, support staff, and equipment should be shared so that everyone can benefit. Better data on those left behind will help us reach them. Disadvantages often accumulate. We can't address inclusion one group at a time. Redressing these disadvantages requires funds. These must be equitable and target individual-specific needs. We must work together on these tasks across government ministries, from central to local authorities, with civil society supporting governments, and schools opening doors to the community. Inclusion in education requires a change in mindset in society, so that education for all means education for everyone, without exception. Achieving this is everybody's business, including yours.
Thanks. So let me go back to the presentation and to delve into some of these messages and the recommendation of the report. For those of you, first of all, who are not familiar with the Global Education Monitoring Report, it has received the official mandate to monitor progress in education in the Sustainable Development Goal Agenda. And in fact, the theme of the Global Education Monitoring Report 2020 was an inclusion in education, a concept, a principle that is really core to the agenda and to SDG 4. And the report has been launched in end of June of this year. Next slide, please. All countries have committed to inclusive education when they signed up for SDG 4 to be achieved by 2030. And this is really a commitment we cannot afford to lose sight of. And if anything, the case for it has become stronger over time. The Global Education Monitoring Report has referred to inclusion as a process that embraces diversity and builds a sense of belonging to achieve social cohesion. As we heard also from the video, these actions are rooted in the belief that every person has a value and potential, and then it is about neither discriminating against not rejecting anyone. It is instead about adapting to learners, making accommodations, not about learners adapting to the system. And we know very well that the case for inclusion has been championed by those that have and continue to support the rights of people with disabilities to ensure the right to inclusive education is guaranteed in international laws. But, and this is something the reports highlight and stress a lot, is that inclusion is not about one single group. The mindset and the mechanism that generate discrimination and rejections are the same for all those that are excluded or at risk of exclusion. Every society needs to own up to their mechanisms that exclude. Next slide, please. The Global Education Monitoring Report has, however, shown that, unfortunately, identity, background, and ability still dictate education opportunities for too many in too many countries. And the report has looked at the discussion into inclusion in education, both outside and inside the education system. First of all, because a discussion of inclusion has necessarily to start from 258 million of children, adolescents, and youth that are out of school. In 12 countries, children with disabilities are 2.5 times more likely never to go to school than their peers. Adolescent refugees are 3 times more likely to be out of secondary schools. And the world set a target for all to complete secondary education by 2030. However, in at least 20 countries, not a single poor rural woman does. Among those that complete lower secondary school, the richer students are 2 times more likely to learn basic skills than the poorest. And this is for those that are out of the system. In addition, looking into schools and classroom, stigma, stereotypes, and discrimination means millions more are alienated inside classroom, inside schools, and less likely then to progress through education. For example, as the screen shows, in the United States, LGBTI students are 3 times more likely to stay home from school because of feeling unsafe. Grade 4 students not learning their home language are 34% less likely to learn basic reading skills. Next slide, please. We have also seen, and we continue to see, that COVID-19 has added a new layer of complexity. Many online solutions to learning continuity have been inspiring. However, they offer only a partial substitute for the educational experience of many. And their uptake is also directly linked to countries' income. As the chart shows, and the report has shown, in primary and secondary education, they were used by about 50% of low income, 73% of lower middle income, and 93% of upper middle income countries. Low and middle income countries are by far most disadvantaged in starting to an effective transition to online learning platforms. In fact, in global terms, opportunity to learn online have been really the exception. Only 12% of households in the least developed countries have internet access at home. And even low-tech solutions are not working. Among the poorest households in Ethiopia, only 7% own a radio and none own a television. In Burkina Faso, Burundi, and Chad, just 50% of the population had access to electricity at home. Next slide, please. Everywhere, however, disadvantaged students have been the least likely to benefit because they lacked the right device, they lacked internet connection or home environment. In OECD countries, for example, 1 in 20 students and almost 1 in 10 of those attending disadvantaged schools lack an internet connection at home. And this share rises, for instance, to 1 in 4 in Chile, 1 in 2 in Turkey, and almost 3 in 4 in Mexico. In France, teachers had lost contact from at least 5% of students in the first weeks after the lockdown was announced. Based on the questionnaire of the Global Coalition for Education, UNESCO, UNICEF, and the World Bank, 40% of low and lower middle income countries has taken no measure to support disadvantaged learners during the school closures. And for those hundreds of millions of students, learning stopped completely, and some may not go back to school if their family was plunged deeper into poverty. In addition, the COVID added a layer of complexity to the finance and financing of education. New GEM report calculation show that global aid is likely to decline by up to $2 billion from 2018 to 2022 as a result of the recession caused by COVID-19. This poses serious threat to the recovery of education from the unprecedented disruption caused by the pandemic. In addition, costs related to COVID-19 school closures are expected to increase the annual funding gap by a third. Education budgets must be at the very least maintained, if not increased, with more flexibility in funding so that existing support can be realigned. Acting now with immediate remedial programs, helping children re-enroll and catch up, could reduce the additional cost due to COVID by 75%. Next slide, please. Turning to the recommendation of the report, there is one that matters for all countries. The report calls for all countries to widen the understanding of inclusive education, to encompass all learners, regardless then of identity, background, or ability. Yet, as the GEM report has shown, many governments do not base their laws and policies on this principle. The report found, for example, that 68% of countries have a definition of inclusive education, but only 57% of those countries cover multiple marginalized groups. Next slide, please. The report has also other recommendation, of course, for governments to help them address the challenging of creating and fostering inclusive education. The first is about financing and about target financing to those left behind. Inclusion is not costly by definition. Simple gestures and ways to manage a classroom cost nothing and are the most valuable contribution to inclusion. Still, efforts need to be made to ensure we get equity and inclusion right through funding. Share expertise and resources. This is the only way to transition to inclusion. In fact, a legacy of segregation means that human and material resources to support diversity have been concentrated too often in a few places and are too unequally distributed. Mechanisms such as resource centers, incentives are needed to move specialist resources and ensure that they support all mainstream schools. The report calls for meaningful consultation with communities, parents, and students. Schools and governments should invite parents and communities to voice their concerns and treat them as equals in the design of policies and programs on inclusion in education. The Global Education Monitoring Report 2020 also calls for closer cooperation across government departments, sectors, and tiers, so that there are integrated services helping learners with multiple intersecting needs. Next slide, please. Cooperation extends to non-governmental actors who are critical partners in achieving inclusion. In fact, government must make space for non-governmental actors to challenge and fill gaps, while making sure they are working towards the same goal of inclusion. Universal design is crucial for fulfilling each learner's potential, not just in terms of infrastructure, but also curricula and textbook. All students should learn from the same flexible, relevant, and accessible curricula that recognize diversity and respond to various learning needs and leave no one behind. Now, more than ever, teachers need training on inclusion. The educational workforce should be empowered and prepared to teach all students. And we will be launching a new policy paper in the coming weeks on this topic. Lastly, the report calls for countries to collect data on and for inclusion with attention and respect, to know where inclusion needs to be fostered and not to discriminate or generate stigma and stereotype or exclusion. Next slide, please. Alongside the report, the Global Education Monitoring Report team has also launched a new website that is the PEER, where you can see the website address on the screen. And the PEER forms a thread with the reports to other websites, wide, that is on education inequalities within and between countries, and Scope, which uses data visualization to compare trends over time and patterns across countries on SDG 4 indicators, offering in addition insightful narratives. I will focus very briefly on PEER in the last part of my presentation. In fact, the PEER website includes profile describing how every country, including yours that are here today listening, approaches inclusion in education through its laws and policies. It is a companion to the 2020 Global Education Monitoring Report. And in fact, the profiles will be updated according to the theme of each new Global Education Monitoring Report, starting with financing profiles to launch in January 21, and continuing with the non-state actors, that is about next year report. Based on the content of the PEER, we have computed, for example, that 68% of countries have a definition of inclusive education, 82% of countries have a definition of special education needs, and 19 countries out of 195 have adopted a comprehensive inclusion concept in their education law. And progress towards education is really hampered, inclusion in education is hampered by incurrent legislation and policies. You can go to the next slide, please. That show you the screen that you will find when you go on the website that I show you. And I conclude by saying, so next slide, please, that we ask you really to help us to disseminate the conclusion of the report and download the report. And also stay tuned. We are launching the gender report on the 9th of October. Thanks a lot for listening.
Thank you so much, Anna and colleagues at GEM. We've put the link to the report in the chat. Such important work and important recommendations for us always, and particularly with the impact of COVID-19. So thank you, Anna. I'm now going to hand over to our colleagues at the World Bank. Another Anna, welcome Anna Martin. And Anna's going to be talking to us specifically on the lessons from the impact of COVID-19 for learners with disabilities. Over to you, Anna.
Hello, everyone, and thank you for this opportunity to be a part of this discussion. I'm with the World Bank's Disability Inclusive Development Team and specifically work with the Inclusive Education Initiative, which is a multi-donor trust fund which invests in supporting countries in making education progressively more inclusive for children with disabilities. We've recently launched an issues paper titled Pivoting to Inclusion, Leveraging Lessons from the COVID-19 Crisis for Learners with Disabilities to provide guidance on recommended practices for disability inclusion as requested by our country teams early on in this pandemic when schools were beginning to close globally. Next slide, please. In this paper, we focus on key thematic areas covering inclusive learning, supporting teachers, ensuring disability inclusive social protections, family and community support, nutrition and WASH, and education financing. We provide recommendations across 3 response phases, including the relief phase for more immediate actions needed to ensure inclusive responses while learners are away from their classrooms, the recovery phase, which outlines the medium-term strategies that need to be taken to ensure that as schools reopen, learners with disabilities are not left behind, and the resilience phase, which includes more long-term actions that need to be implemented to increasingly make progress to be more inclusive, equitable education environments. As a guiding principle of the World Bank, in this paper, we incorporate the twin track approach throughout all phases. Next slide. I'll briefly touch on each thematic area and how we can leverage some of the lessons we've learned as we respond to this pandemic and other emergency settings. We know that many higher income countries are using online platforms and that many low and middle income countries are using television and radio to ensure that education continues. Some countries, such as Ghana, have utilized SMS to send and receive assignments. However, even the most basic of platforms for providing distance learning can pose challenges for learners, especially those with disabilities. There's inequitable access to devices, internet, and data. Parents and caregivers often struggle to support their students learning at home. There might be limited or no access to assistive devices or accessible learning materials that might have been available to them at their schools, and there's a lack of individualized learning. The universal design for learning approach allows for the largest diverse group of learners to draw the maximum benefit, as it acknowledges that in a classroom of learners, all are different. They understand, they process, and they express things differently. And teaching, as well as learning, should utilize a multitude of methods to support all learners, including learners with disabilities. This approach is not limited to the classroom and can be used in remote learning settings. It can be used by children who have never been to school, have dropped out, or are catching up after having missing lessons due to emergencies. As an example, Rwanda has provided sign language during their educational TV programming, and resources have been printed in Braille and disseminated to those who require them. They're utilizing the Rwanda Education Board e-learning platform, YouTube, WhatsApp, radio, and TV for continuing their learning and developing accessible textbooks and learning materials by following UDL principles. Next slide. In preparing and supporting inclusive, resilient teachers, we must consider the new and unfamiliar methods of remote learning that they're having to work with. They need to feel supported through continuation of salaries, parental engagement, and support from their school administration and local and national governments. The graph shown in this slide shows data from a survey we conducted in May, which asked teachers of children with disabilities, as well as parents of children with disabilities and persons with disabilities, about the supports of learners with disabilities as countries were responding to the pandemic. 21% of teachers who responded to this survey were feeling unsupported. They need increased training on the technology that they are using and guidance on how to best engage their learners with disabilities with these new methods and platforms, as they're not the same as teaching in a classroom like they're used to. Communities of practice over WhatsApp are a great way for teachers to share their best practices among colleagues, particularly tapping into the knowledge of teachers who have more experience working on disability inclusive education as they navigate these new territories. Next slide, please. Children with disabilities tend to be part of poorer families, and poverty may be exacerbated by parents who must reduce their workload or must stop working to provide care and supports to their children. Many families with children with disabilities also incur additional disability-related costs. These issues become more pronounced during emergencies where resources are further stretched. Our survey noted that key concerns among parents and caregivers of learners with disabilities included not only the learning loss, but the lack of access to therapy and services and accessible educational materials. Social protection is essential to bolstering income security, access to healthcare, and contribute to disability-related expenses for children with disabilities and their families. These mechanisms can come in the form of cash transfers, in-kind relief, free or subsidized medications, assistive devices and technology, rehabilitation, school waivers, or subsidies. It is important to leverage community-based networks, such as organizations of persons with disabilities and community-based rehabilitation workers who are well-placed to support and work with individual families on learning support, as well as assistance with rehabilitation and care of assistive devices. In Rwanda, community volunteers with an interest in education cluster groups in Nepal, and a teacher training college with expertise in inclusive education in Mozambique are all finding ways to deliver advice to parents using radio and video messaging and phone communication on learning through play, structuring a child's day, among other topics. Next slide, please. For many, meals provided at school may be the only hot, nutritious meal they receive every day, and access to these feeding programs can be the difference between malnutrition and adequate nutrition necessary for growth and development. It's imperative to establish multiple accessible food distribution points that can be easily reached by families, including persons with disabilities. This pandemic has pointed to the importance of accessible wash facilities and the messaging on prevention of COVID-19, which needs to be provided in multiple accessible formats. Next slide, please. The World Bank expects the economic shocks to have severe consequences for governments as well as households when it comes to education. Disability programming is often not covered in the applications that have been received by emergency education funders, and therefore less disability-specific allocations are being made. It's imperative that additional financing for education prioritize learners with disabilities, keeping in mind the twin track approach, which means that there needs to be inclusive mainstream solutions that benefit all and targeted solutions for children with disabilities. Next slide, please. As we look at the education recovery process, it's important to ensure safety, protection, and inclusion are prioritized when reopening schools, possibly in a phased approach, taking into consideration the children who are hardest to reach with remote learning. Measures aimed at reverse learning loss will be necessary, including classroom assessments, smaller class sizes, focused pedagogy, inclusive curriculum, and better use of technology. This crisis that has resulted from COVID-19 presents us with an opportunity to build stronger, more inclusive education systems when we all work together. Next slide. To continue this conversation and find plenty of resources on disability inclusive education, I invite you to join our community of practice on LinkedIn. The link is here, but I'll also provide this and several other links to resources in the chat box following this presentation. Thank you so much.
Thank you so much, Anna. And yes, we'll make sure all of the resources are available to participants in our wider network. And we're now going to turn to our education and emergencies colleagues to talk about how they're doing this in practice in Lebanon. Henriette Chidiak joins us from Humanitarian Inclusion Lebanon to share the work that they have been doing with children and young people there. Over to you, Henriette.
Hello, thank you. So I will directly start with the disability and COVID-19 in Lebanon context. We know that there are over 1.2 million school-aged children that are affected by school closure in Lebanon. The absence of accurate data on children with disabilities that are enrolled in the learning programs, those hindered the response. Inclusion is still being piloted in Lebanon in only 30 public schools, and the inclusion strategy is under the development of the ministry. It is not launched yet. As for the current situation between the COVID-19, the economic crisis, and the Beirut blast of August 4, those exacerbated the pre-existing barriers that the person with disabilities do face while accessing services. Because we are running late and my colleague already covered a lot of info, can we move to the slide 30 so that we can directly go to the adaptations that we did? Thank you. So we will start with one of the adaptations that was covered in the Middle East. I think 2 more slides. It would be that's it in Lebanon and in the region. We did work on a video that was illustrating each page of my hero storybook. It is for children, and it covers information prevention on COVID-19. The material was also used to help reassuring children and parents and encouraging them to return to school. Teachers could also use it as a support for children in the classroom. The materials this material was also worked between all countries in the Middle East, but we also, as HI, covered several materials on prevention and awareness in different formats to be accessible for all, caregivers, children, teachers, and so on. It was shared through voice notes as long as messages, and sometimes throughout videos with perfect illustrations as child-friendly and accessible. Can we move to the next slide, please? Furthermore, the Ministry of Education and the Center for Development and Training had a platform that started like a few years ago. They developed it, but it is not. It does not cover all the curriculum yet. It is only showing by class a few lessons that are divided by objective according to the national curriculum in Lebanon. The platform is still being developed now, and it has specific users and access to teachers and children. And this way, children could learn from home. However, it is not very accessible by all it means, and further development will be added so that more accessibility work is done so that all children with disabilities could access it. For grade 9 and 12, those are classes that have official exams by the end of the year. So those classes were supported on the Lebanese national TV channel. And it was throughout a schedule that was shared with the students and parents for the different materials that were needed for the official exams. The lessons were not accessible for all students because there was no caption. It was not possible to read the lips of the instructor because he was moving a lot while he was talking and explaining what was on the board. There was no sign language interpretation. And if students had any visual impairment, the sessions were too difficult to follow because the teacher was talking in a very quick way, and we could not really follow if we cannot see exactly what was on the screen in front of us. The flow from one exercise to another was not also explained orally. Finally, students with learning difficulties had difficulties to understand the flow and to continue in the exercises because the flow was quick also, but the instructions were heavy and were not simple at all. Can we move to the next slide, please? So here we have more examples from Lebanon. So in the 30 pilot schools, there are teachers and special educators who work together with a pilot team of therapists. So they had to work out on the objectives of each session to make it as accessible as possible. And it was more on an individualized level. So they knew that they had a person or a student with a visual impairment. Adaptations were made directly for this child. As for what HI was also doing, so we were supporting children throughout these 2 years, ever since the pilot project started, in providing assistive devices to children with disabilities to be able to enroll in mainstream learning program, if it was formal or non-formal education. Accordingly, we assessed around 700 students that were out of school or already enrolled, and provided the ones who needed assistive devices so that they can continue learning. During the pandemic, those tablets and laptops with screen readers that we already distributed were used so that they could access remote learning and do specific one-on-one sessions with the teachers so that they can really understand the content, but moreover to be able to do the exercises that were not really adapted for each individual aside. Can you move to the next slide, please? In the interagency education sector, they already shared with us, as soon as the pandemic started, an online folder that all education organization had access to. So this Excel sheet had a lot of compiled materials and suggested activities and links that could support the learning, and mostly it would cover Arabic, English, and French, also math and science, for different ages, and it was divided between the ages according to the non-formal education programs. So it was 3 to 5 for the early childhood education, 6 to 14 for the BLN or for the ALP, basic literacy and numeracy, or the accelerated learning program. Adding to that, and what was really good for the teachers, but also for parents, was the social and emotional learning, YouTube links that would assist caregivers and teachers so that they are more engaged. Teachers would have the resources needed also to understand better the emotional, how to interfere with children and how to support children in those times during the COVID and the lockdown. World Child Holland, who is one of the biggest education organization providing non-formal education in Lebanon, developed a platform that is used in their different countries of implementation. It is also curriculum-based. The context and specific solution were according to the needs that they saw on the field. And the curriculum is under the approval of the Ministry of Education for the time being. It gathers the objectives of the sessions, and I have links so that children could learn while playing, and it is called Can't Wait to Learn platform. Can we move to the next slide, please?
Henrietta, just a few more seconds, sorry to interrupt.
Yes, I'm closing. So the holistic and multi-sectoral approach that my colleagues talked before about are a priority for us in Lebanon, but also we know that it is a priority worldwide. Education for us and for many people is the first line of defense to mitigate and the risks and everything related to inclusive education. It is the most effective way to provide a quality education to benefit all children. And finally, we should rethink education with an inclusive lens for learning, prepare inclusive and resilient teachers, but also allocate sufficient budget so that we can implement all the guidelines that are supporting the back to school and the coming year so that it is safe for everyone to start accordingly. Thank you.
Thank you so much, Henriette. Sorry to interrupt. I'm just very conscious of time, but really important recommendations for us there. I'm going to hand straight over to our colleagues at the Girls Education Challenge and invite Michelle Lewis-Sandal to help us think about a different element, but very important element of inclusion. Thank you so much, Michelle. Over to you.
Thank you very much. So next slide. So what we're going to be looking at is the emerging learning on looking at how to keep girls engaged in learning and prepare them to return to school during COVID-19. So overview of Girls Education Challenge is we're looking to accelerate the learning of millions of marginalized girls, and you can read the rest later. Next slide. So we're working, you can see where we're working in 41 projects in 17 countries. In my particular area, and usually where I live is in West Africa. So some of what I'll be talking about will have a bit of a West Africa lens. Next slide, please. Okay, so what we've done is looked at a constraint analysis, which is really focusing on what is keeping girls or constraints on their capability to learn. So this is looking at multiple intersecting constraints that have an impact on girls' completion and transition rates. And this was done before COVID, and you can see in the red where we've adapted it to address the particular constraints that girls are facing at the moment. And then when girls go back to school, we'll have to do another analysis on this. Next slide, please. So a colleague of mine in Girls Education Challenge had written a fantastic paper called Inclusive Approaches to Dropout and Retention in Low Resource Settings. And it looked at what we have learned on retention, so keeping girls learning, keeping them in school. And we've looked at how we've adapted that for COVID-19. And if you can look at the cycle, first of all, we're looking at data collection, then we're looking at data analysis, following up with the girls and families, responses to dropout, and assessing quality of the response. Now, this has all changed because of COVID. Obviously, data collection has changed significantly. We've been looking at data we had already collected, but then also doing it through WhatsApp, mobile phones, and then some face-to-face data collection where we've been able to, with non-tech-based solutions, such as looking at trusted mentors or contacting parents, doing it in public places like at water points. Now, obviously, this is all according to our safeguarding protocols, which we follow. Then we're looking at the analysis. Now, this includes a GESI analysis, gender social inclusion analysis, looks at what we're finding out from girls themselves, looking at technology mapping, finding out from groups of girls. For example, in West Africa, we found that there's been a significant increase in GBV. There's been a significant decrease in girls' perceptions of their own well-being, with an increase in feelings of anxiety, loneliness, and sadness. There's been an increase in responsibilities such as childcare and chores. And in the families, they're much worse off financially, with food insecurity and limited access to learning through phones or even through electricity, difficulties with accessing electricity. When we move across to the data analysis, we need to also look at, as I said, what triggers a response. So how do we know when girls are likely to drop out? So then we look at how that, and that has changed quite a bit since we were working pre-COVID-19. And one of the only ways we've been able to do that is by working through like community groups or mentors who are providing a lot of support. So with community support, we have community support workers, which are, they may be community health volunteers, they may be community mobilizers or mentors or teachers or community-based rehabilitation volunteers. And we're also working with girls to give peer support to each other where possible, obviously with the COVID-19 restrictions. We found that these community support workers are often under a lot of burdens themselves in terms of their family responsibilities. And so not only are we working with them to provide psychological first aid or psychosocial support to the girls, but we're also providing psychosocial support to these mentors or community-based rehabilitation volunteers, as they also, we found, need support from the program. In terms of response, we've done remote learning. This is on a national level, local level, TV, radio, through phones, WhatsApp, supporting parents, as I said, psychological first aid, targeted support, and some paper-based support of learning, as well as some catch-up classes as well. And obviously this is all going to change when girls are going back to school as well. And then the last point is that we need to assess the quality of the response and develop really strong feedback loops, which are really important, particularly in a humanitarian setting. We can go to the next slide. Thanks. So our learning has included this adapted remote data collection, analysis and response systems, including GESI analysis and well-being monitoring. Local community networks, including mentors, disabled people's organizations, and these will be important when schools reopen to support the reintegration to school for marginalized girls. Clear definition and ownership of roles and responsibilities, and obviously that comes with heavily caveated around safeguarding as well. Understanding what qualifies as risk and adapting the response. Linking to other actors such as referrals, finding out and mapping what's available and how we can link to them. Keeping feedback loops nimble enough to respond swiftly and track if responses are effective. And we've been doing a lot of remote monitoring of this with girls themselves, as well as caregivers and community members. And then we're working on 3 different levels: tailored, targeted, and universal. So next slide. So, and I know we're running out of time, but in terms of our responses to retention, we're really working with individual girls at high risk. This is including girls with disabilities, girls who are pregnant, with very highly intensified individualized interventions. We're then working at targeted groups of girls at risk with additional support for students. And then we're working at a universal level as well. And next slide. In terms of what we're actually focusing on COVID-19 and the different levels, these 3 different levels, we're looking at continuation of teaching and learning, well-being and resilience, social protection and safety, influencing society institutions, and return to school and learning centers. And the data and the lessons that we're learning are also feeding back into our of society, so work with governments and the education sector as a whole, really trying to focus on combating exclusionary norms and really trying to influence society and institutions. Thank you.
Great, thank you so much, Michelle. Really appreciate it. And again, we'll share all of the resources mentioned today via INEE and in the chat box. But I'm excited now to hand over to our field colleagues to hear more about what these things are looking like in practice. So over to Mpusu Jama, who's going to be joining us from Zimbabwe to share more about the work on inclusive education there. Mpusu, can you hear me? Great.
Yes, I can. Thank you so much, and good afternoon to everyone. If you can move on to the next slide. So I'm going to be presenting on one of the Girls Education Challenge projects in Zimbabwe, which is the IGET, Improving Gender Attitudes, Transition and Education Outcomes. It's a consortium led by World Vision with stakeholders that you can see there on the screen. Next slide, please. So the IGET project has 4 components, and these are a whole school development where we are doing teacher professional development, materials production, as well as school leadership, capacity building, and child protection. The other component is more a non-formal education component, which we call community-based education, which provides a second chance to learners who dropped out post grade 6, just to try and prevent competition so that we don't get schools coming from the formal to informal, because we provide skills. Then the next one is on girls leadership, where we strengthen girls leadership and life skills competencies. And finally, the community engagement piece, where we work on mainly one of the key areas there is a religious sector. We've got an apostolic sect that don't believe in education. So they don't send their kids to schools, and they don't they do home birthing, so that they don't go to hospitals. At the bottom there, you can see some marginalization subgroups. So with about 19% of our cohort, this project is reaching out about 65,000 boys and girls, but it's got a gender lens because it's focusing on girls mainly because we are trying to address the equity and learning gaps. So we have 19% of our cohort being orphaned, and mainly due to the HIV scourge, as well as we have about 30% of the learners there, they don't live with their parents, they live with their grannies or other relatives. And so these are some of the 10% of our cohort, so they have some disability. So we use the Washington Group questionnaire to just try and understand the prevalence of that. So one of the, I think, sort of like quick wins really was to identify these girls so that we can help them. Next slide. So we had our framework, which had those 4 themes. But when COVID struck in March, so we had our schools closing prematurely, and we had to adapt our project so that we respond to COVID. And also, so we focused on 3 key things really. That's keeping girls learning despite the challenges, as well as responding to COVID and ensuring that girls were safe. The main reason there on safety really is that we have a lot of adolescent girls who are prone to abuse, especially when they are not in school. And also we anticipated food shortages as livelihoods sort of like were constrained due to the lockdown effects. So in terms of keeping girls safe, it meant us that we had to redesign in terms of identify who is going to be teaching, and also what is going to be the medium for teaching, and what kind of materials are going to be used, and how to get the learners ready. Next slide. So this is sort of like a menu, it's like an a la carte really of what we provided as a project to the community. And this was more like a gap filler because the government had promised to provide something like radio lessons, and also as part of Quick Wins, they did, excuse me, they did also provide digital learning, but that could only reach the urban learners. So we provided a comprehensive, what we call community learning centers. So during lockdown, mainly we focused on home learning, where we made sure that there's an adult and there's materials. We have about 9% of the rural learners, and that's where 100% of our schools are in the rural schools, rural communities. So we have about 9% of the rural learners having more than 3 books at home to read. So those are some of the context challenges that we encountered, and try to see how we address them. And then when lockdown was relaxed, we also did some study circles. This is more like a group of 10 to 13 learners that can meet and with a facilitator, and then they continue learning. And also we provided relevant materials and made sure that girls are aware on what was happening. And just to say as well, for context, since 24 March, schools have not opened in Zimbabwe. I was calculating, that's 173 days, and 75% of that time, that's learning time that's been lost. Next slide. So just talking about how we established the community learning centers, we identified what we call resident teachers. They are teachers who reside in the schools normally, and we relied on them. So we leveraged on that, and we had already contact numbers for the existing stakeholders. And we identified how we can reach to the households and learners. And the 2 areas really that we used was the WhatsApp group. So we formed virtual groups so that we can reach out to learners. And I'll talk about that in detail on how we did it. But it meant also identifying some community volunteers that we were helping the project over time, and we had their contact numbers as well, and they were part of the groups that we created, and we provided capacity so that they can handle these study circles. Next slide. This is just to illustrate on how we reach to the learners. If you can see the green route there, it's for those that had WhatsApp. So for households with WhatsApp access, so we'd send around each school content and also daily activities to the volunteers and resident teachers, who will in turn have an average of about 10 to 13 learners, either pass it on directly to the households. So it was meant really to keep them the learners active, not to make sure that we are marking and giving them probably feedback, although feedback was given in the study circles. Then there's that other orange route where we had pre-positioned material that we developed during the COVID period, and that will go via to the either the volunteer the volunteer can take those copies physically. So we provided also PPE for the volunteers to deliver those to the households. You can see the WhatsApp, the illustrations, and the one of the a group there working on the activities. Next slide. This is just to illustrate as well that we had some COVID-19 standard operational procedures. Before the girls met, they would ensure that they do some, they wash their hands, they are reading there, and then that's one of the numerous activities. Next slide. In summary, in closing, really, the 4 key things that kept us on top of the game was more on advocacy, because we represented the voice of the marginalized schools, as mostly the government did not have resources, and their low-hanging fruits were mainly digital learning to urban learners. So we were the advocacy arm for the rural and marginalized girls. And also we leveraged on existing community relationships to set up the WhatsApp groups. Context knowledge and the adaptive management. So as a project, we have long and short sort of like adaptive loops that we use with the donor and the fund manager over time to adapt the project. So that came in handy during COVID. And just to say that community learning centers were there to complement you know, what was available in the market and also reach the marginalized girls. And at the bottom, you can see the challenges that we encountered there, because not everyone has a mobile phone, and also the lack of reading materials at home. And even though some had adults at home, the adult literacy, I think only about 19% do have education beyond primary. So that's, do not have education. So it meant we had to improvise as well in terms of how we reach out to the learners. And if you reflect back on the menu that I provided, so learners had opportunities to attend whatever was suitable at the appropriate time. We didn't create a school environment in the community, but we made sure that the community environment was conducive for learning. I think that's my last slide.
Wonderful. Thank you so much, Bruce. Such fantastic examples and inspiring work for all of us to hear. And I'd love to hand over to our next practical programmatic example. Mohammed Diat joins us, the Education Advisor for Care Somalia. Over to you, Mohammed.
Thank you so much. I'm going to present on behalf of Care Somalia and the Girls Education Challenge. So the Adolescent Girls Education in Somalia is a 4-year project funded by DFID's Girls Education Challenge. And the project is implemented in southern and south central Somalia, covering geographic portions that have been most impacted by the 3 decades of conflict, and is also home to Somalia's most marginalized clan groups and linguistic minorities. So the project actually targets 42,000 girls that are actually marked by different marginalization frameworks or vulnerabilities. So to the next slide, please. So in our current cohort of about 21,000 girls, 34% of them are girls with disability. And as you're going to see from this presentation, we are actually going to challenge some of the assumptions that are mostly held in terms of the types of disabilities with a major focus on physical forms. So we are going to demonstrate about the hidden forms of disability that the project has been able to collect evidences and therefore base its intervention based on those evidences. So we have 18% with language minorities. And this is actually very interesting because it hasn't crossed the mind of anyone that in Somalia, there are groups that have a different dialect, and that because of their dialect, they are excluded from actually learning, and that has actually impacted their learning outcomes. We target adolescent girls aged between 17 to 19 years. 4% of them are actually married, 5% are young mothers, and 7% are divorced or widowed. We have orphans in our target group, and 19% of them are actually of our target cohorts are excluded groups, 31% internally displaced girls. Sometimes you'll find compounded marginalization in our framework. A girl can be orphaned, but at the same time also living with disability, and also could be from a displaced family. So the next slide, please. So during this COVID-19, the project has actually conducted a remote assessment to find out actually how the girls were faring. And the findings actually correlate with others globally. 71% of our target girls have reported increased workload. 53% actually continued to study at home. This actually has challenged also some of the assumptions that we were having, because we never thought the girls will continue to study at home during this lockdown, when actually there were no alternative forms of learning provided by the government. There is severe economic downturn. 33% are actually facing food insecurity. 47% have limited access to water. But the most important thing actually, and the good news, is that despite the fact that the girls were reporting increased workload, that did not reduce the engagement in remote learning. Again, important is that the girls with disability, their learning scores were actually similar to those without disability, an indication that actually the project intervention on inclusion was working. So the next slide, please. Our model of inclusion actually looks at finding out some of these hidden forms of disability. So our baseline survey has revealed that 31% of our girls were actually facing severe anxiety and depression, almost on a daily basis. So of the large percentage of girls with disability in our cohorts, only 8% have physical forms of disability. This again was also mirrored by the adolescent survey we conducted during this COVID-19, because there were an increase in anxiety as a result of COVID. So, and this was prevalent especially with older girls, those aged between 17 to 19 years, as opposed to the young ones in the primary schools aged 10 to 12 years. Next slide, please. So in responding to actually these exclusions, the project looks at a systemic model that is centrally focused, providing interventions that are individualized, looking at every individual girl in our cohort as an individual person, without actually designing a common method of approach. So we have provided remedial contents because the schools in Somalia reopened on 15th August. So the girls are now back to class and they are studying. So because they are a group of girls, especially those with disability and those from linguistic minorities, we are giving them remedial content every week, where they go do at home, and then the teacher checks at the end of every week to find out how they were doing, and if there are any learning gaps that he notices from that work, the teacher then provides individual supports. And this is usually done on Thursdays because they study up to Wednesday. Then in terms of economic empowerments, because of the large number of households that are food insecure in our context, and because that also affects the learning outcomes of the girls, we have a platform known as VSLA, which is a Village Savings Loans Association, in which older girls in our NFE cohorts are actually part of that. They are taught financial literacy, entrepreneurship, in which after the 11 months NFE classes, they are able now to join and continue. We link them with banks, and then they can venture into business. We have the Girls Empowerment Forums, which are actually girl clubs, and they play a very important role in ensuring that our retention rates are high, in bringing back the dropouts, and they have actually been providing peer-to-peer support during this lockdown. Within our manuals in the girls forums, we have a section on stress management with a focus on psychological first aid. At the community level, we have a strategic partnership with the communities. We work with the CECs in doing awareness, community education committees. We also work with local disability partner organizations in bringing these girls with disability to come to school. At a higher level, we provide tailored support to our teachers, inclusive classroom practices, and how to be able to provide these flexible learning options to our girls. To the next slide, please. In terms of language minorities, our findings have revealed that children whose mother tongue actually differs from the language of instruction, they have significantly lower reading and comprehension and numeracy scores in relation to their peers. This was actually an interesting finding because most of the times we look at the main language without necessarily giving a focus on the dialect and who the teacher is in the classroom. So some of the strategies we came up with, one, we ensure that in our flexible classes, the alternative basic education and the non-formal education classes, we come up with the strategies to ensure inclusion of these girls. This even includes the use of language assistance. In our identification and enrollment, we refine it to ensure that we prioritize this group and provide additional catch-up support to these girls. Then the coaching we provide to the teachers, we don't only leave them with the training, but also provide coaching on how to develop competencies and strategies to support learners whose first language is different from the language of instruction. So the next slide, please. Yes, so some of the important successes we can mention is that because of the approach in which we had put in place, the learning assessments has actually revealed that there are no statistical differences between the scores of girls with disability and non-girls with disability, an indication that the project's approach is catering to these groups' needs. Some of the challenges we faced during this period is that the government rollout on the digital platform actually delayed, and as a result, therefore, affecting the options that are available to the girls. And in schools where we have girls with severe forms of disability that cannot be included in the main schools, the schools are lacking adaptive facilities. So to me, actually, what is most outstanding about our work is the fact that the evidences that we have been continuously collecting has actually helped us to focus on some of the needs and barriers of these groups that are actually invisible and hidden in a context that it is sensitive to address these barriers. Thank you so much.
Thank you so much, Mohammed. Again, such rich and practical examples there. We really appreciate all of our panelists today sharing what a rich mix of panelists. And I'm now excited to hand over to our last speaker today. And so I'd like to invite Dr. Joseph Murray, who's going to share some broader reflections around building back better. So over to you, Dr. Joseph Murray. Thank you for being with us today.
Hello, everyone.
Andrew, go ahead and stop the screen share, please.
INNE for welcoming me to this webinar. Today, I would like to talk about what we know about inclusive education for learners with disabilities, framing my remarks around the COVID-19 pandemic. First, I'd like to briefly discuss what existed before and during COVID-19, and then offer some recommendations on building back better. And by this, I mean I want to outline what conditions need to be in place to ensure our post-COVID-19 future is one that takes clear and deliberate steps forward, ensuring that education for all does indeed mean all. The World Federation of the Deaf is a member of the International Disability Alliance, or IDA. And the IDA, through the work of its 8 global and 6 regional members, has issued an Inclusive Education Global Report, which outlines the minimum conditions necessary to achieve Sustainable Development Goal 4 in compliance with the United Nations Convention on the Rights of Persons with Disabilities, or UNCRPD, especially respecting its Article 24 on the rights of all learners with disabilities. This global report expresses the disability rights movement's common vision with regard to inclusive education. A critical message of this report is that building a truly inclusive education system is the only way to achieve SDG 4 for all children, including children and youth with disabilities, whomever and wherever they are. Inclusive education requires an educational transformation. And an educational transformation is exactly what is needed at this point in time. Even before the pandemic, 50% of children with disabilities in low and middle income countries were out of school. The WFD estimates less than 2% of deaf children in the world have access to a bilingual education in their national sign languages. There is a clear and urgent need to transform our education systems to ensure they are truly inclusive, including all learners with disabilities, learners from marginalized populations, and women and girls, including others. The COVID-19 pandemic has starkly illustrated these existing disparities. International actors have recognized that people with disabilities already at heightened risk during COVID-19 are also an intersectional group which needs to be recognized in their full diversity. As president of the World Federation of the Deaf, I met our 125 national associations of deaf people to learn about the national level response to COVID-19. What I found out was that these deaf associations are often at the front line of providing critical support to the public and to governments. These organizations were providing access to information in national sign languages and assisting governments and families of deaf children on how to ensure continuity of equitable and accessible education in national sign languages. The same is true for other organizations of people with disabilities. IDA and its member organizations, including the WFD, have developed guidelines on our websites on accessibility, including education access during the pandemic. Among other things, this includes ensuring all remote learning is fully adaptable and accessible and tailored to the learner's needs. Platforms should be accessible via captions and sign languages, but also by sharing materials with parents and caregivers in advance. For parents and caregivers, support with learning materials and services the child normally receives in school is absolutely critical. This can include positive behavior support, toolkits for physical therapy, modified lesson plans for learners with intellectual disabilities, and remote teaching assistance. We are trying to find our way forward in these challenging times. As we do so, we should be mindful that what we build today should last going forward. We should be building models of fully inclusive distance education that will last beyond this immediate crisis. Models that can be adopted to different emergencies going forward, be they successive waves of COVID-19 or other humanitarian assistance situations, such as natural disasters. Going forward, how do we build back better? First, by recognizing shared responsibility for inclusive education. Governments need to make significant investments in the recruitment and training of qualified teachers, including teachers with disabilities, ensuring non-discrimination, zero rejection policies, and accessibility, including access to facilities, to the curriculum, and to the language used at the school. For deaf children, the only fully accessible language of education is an education in the national sign language with peers who are deaf and use the national sign language. Governments should ensure families and communities are involved in monitoring and evaluation activities. Organizations of people with disabilities have important roles to play post-COVID-19. DPOs need to be understood as frontline resources within communities, schools, and systems. DPOs can and should play a key role in policy development and implementation. And people with disabilities are resources which should be tapped in ensuring inclusive education in humanitarian and emergency situations. To take one example, at the world's largest refugee camp, the Kakuma refugee camp in Kenya, 3 schools provide sign language-based education for deaf children. All their teachers are deaf, and all, save one, are themselves deaf camp residents. Peoples and organizations of peoples with disabilities are resources for building inclusive and equitable education systems. Donors and external funding sources should ensure their inclusive education initiatives comply with SDG 4 and the UN CRPD by making all funding contingent on disability inclusive provisions. The IDA calls upon all INGOs to pledge their support to the design and implementation of inclusive education systems going forward. In Building Back Better, we need to understand what actually happened. Therefore, we need to actualize the numerous calls for reliable data about the impact of COVID-19 on inclusive education, disaggregated by age, sex, and type of disability. Data analysis and reporting should be disability aware, and findings should be used for post-COVID program creation and implementation. Finally, in the spirit of all means all, I would like to share that the week of September 21st is the 62nd International Week of the Deaf, with the theme Reaffirming Deaf People's Human Rights. As part of this week, we are celebrating the International Day of Sign Languages on September 23rd. This day is recognized by the United Nations, and the theme is Sign Languages Are for Everyone. Please join us and let's work together for equitable, accessible, language-rich education for all. Thank you.
Thank you so much, Dr. Murray. Such powerful and important words to end with there. And I think lots for us to think about and lots of recommendations for us to all take forward in our work as we work together on such important issues. Thank you, and thank you to all our speakers. We do have about 10 minutes for question and answers now. So I'm going to invite all our speakers to turn their videos on. So please do come on video, everybody. Hi there. And while people are turning their videos on, we've just got a very quick poll for you today. So if you don't mind just quickly answering these poll questions, and then we'll get the Q&A started. Fantastic. Great, brilliant. Thank you. It's great to see you all there. As we're short for time, we're going to really focus on one question, and hopefully it builds on all of the presentations and Dr. Murray's important words for us there at the end. And we've had a lot of questions about advocacy. And I think as we're hearing the challenges and the concerns people have in their work at the moment, and the urgency with which we need to act and prioritize this area of work, and the real potential for change at the moment if we do work together. We have several questions on advocacy, which I'm going to try and combine, but really recognizing the competing demands on policymakers, decision makers, budget holders at the moment. What advice can you give to our participants and our members to advocate for inclusive education and to make it a priority? And whether that's around education, whether it's around evidence, whatever that may be, we'd love to hear your reflections and some advice on how we can advocate for these issues. Henriette, can I come to you first on this? Any advice on how you've perhaps been doing advocacy around your fantastic work in Lebanon?
So, yes, sure, I can start with that. We are trying our best to make sure that we are including everyone, not only people with disabilities, and not only targeting the first shift, which is for children who are Lebanese or students who are Lebanese. We also want to target students who are refugees. Even if they do have disabilities, they have the right to attend learning programs, if it is online, through remote learning, or face-to-face. On the other hand, we are trying a lot to work with the Ministry of Education and Higher Education to make sure that they do apply the guidelines that were shared for a safe back to school, that should be inclusive and that should be implemented so that we can have at least this year, a whole scholastic year, that objectives of the learning are being provided. Thank you.
Thank you. Thank you, Henriette. Yeah, great to hear this example of working with the ministry. And Anna, from the Global Monitoring Report, any kind of advocacy advice from your side? I know you guys are doing a lot of advocacy at the moment.
Yeah, I mean, if I'm not wrong, at the same time we are on our advocacy brief should have been launched. I mean, it's a very important question, the one that has been asked, or the around advocacy. As the report has shown, there are really a lot of dilemmas and tensions in reaching inclusion, or the ideal of full inclusion. And in fact, the situation is not the same in all the countries. Contexts are very different, and we have systems that are different, education systems that are different. There are already some countries that cater or try to cater for learning needs, and others that are really at the first stage. However, as the report has shown, I mean, there are really a recommendation that is worth for all countries: widen the understanding of inclusion in education. It is not for one group. Inclusion means all learners. It means really that the education system should be adapted to the learners' needs, and not the other way around. And in fact, the report, and this is highlighted in the foreword, by the way, and throughout the entire report, that the report does not deny that the full idea, the ideal of full inclusion may have some downside. However, it recognizes the challenges that inclusion or reaching full inclusion may have. And it asks, and if you read the report, you realize that the report really asks if it is really necessary to find justification for inclusive education. In fact, it's really about trying to build social cohesion and social and inclusive society. And sometimes it really costs nothing, because there was some question about the cost. It costs nothing. It is about the ethos of teachers. It is about the ethos of ed teachers. It is about the fact that parents, students, and community are involved in the discussion of the policies. It is about not working in a piecemeal approach. It is about not discriminating and not focus on a particular group. And in fact, that's really the point. There are some changes that can be made easily, others that require more time. However, it is important to be committed to this ideal of full inclusion. And I think with the help of advocacy, and especially also of non-governmental organization and their involvement as a watchdog and advocacy for inclusive education, we may progress a lot.
Thank you, Anna. So yeah, so in the sort of inclusive education is going to bring benefits for everyone. Educating people about that, understanding context, and working together, we all have a different role to play in that. And an important point about not letting budget be a barrier. Thank you so much, Anna. I just wonder, Mbuso, from your perspective in Zimbabwe, have you been able to, what work have you done to ensure the prioritization of inclusive education? Any advocacy advice from your side?
Yeah, thank you so much. I mean, we have tried a lot. One of the things really is GEC has helped us sort of like develop robust evidence generation. So I'll talk about the whole ecosystem of advocacy. So we have developed sort of like evidence. For example, the issue of 10% of learners with disability. If you read the national reports, they talk about 2%. So generating that evidence provides you sort of like leverage to knock at all the doors in the Ministry of Education, Ministry of Gender, and the context is fragmented. So we've had that opportunity with the evidence to participate in all the platforms, national platforms, to advocate for the sort of like the marginalized girls and promote inclusion. And just to say, probably in summary, most of these solutions, they have to be homegrown and they have to be tried out locally. And from that evidence, when you have co-created some of this with the policymakers, it becomes easy to get to that space and make sure that meaningful actions happen. So that's how we've done it. And we've taken that evidence to the donor local, to the DFID office in country, to the Ministry of Education, and it has worked well. Thank you.
Thank you so much. The power of evidence. Yeah, great message there. Thank you, Mbuso. And same question to you, Mohammed. Any advocacy advice from your work in Somalia?
Thank you so much. I think in our context, our approach is mainly systemic. So we look at it from the community-based strategies for advocacy, but also looking at it at a higher level, system level advocacies. So we work with the gender unit in the ministry through what we call the gender focal points, so that at least we are able to ensure that there is gender mainstreaming in the policies at the ministry level. So these gender focal points are actually trained on inclusion. They are trained on the gender perspectives, so that at that level, they will be able to argue about the need to ensure that all policies are gender mainstreamed and are inclusive. At the community level, we have a strategic partnership, like I mentioned, with a local disability partner organization that has grassroots within the communities. They work with an advisory group known as Disability Advisory Group, whose role actually is to ensure that they are able to sit down at the top level and influence the policy on inclusive education. More importantly, again, also is working with religious leaders and Quranic teachers. You know, in the context of Somalia, children are usually taken to Quranic school before they come to school. So like they will be able to come to school at the age of 10 years. So before that, they are in Quranic school. So we have trained our Quranic teachers on disability, so that at least we have early identification and referral to, you know, the pathways in which they will be able to get this support. So when you combine all these alternatives, then you'll be able to develop a solid framework to ensure that everyone is included.
Thank you so much, Mohammed. So yeah, thinking about the system, thinking about the community, collaboration with different actors. Yeah, powerful words there. We are so short of time. Perhaps if I could just come back to you, Dr. Murray, for some just final thoughts. You're obviously such an advocate yourself. We heard that in your words just now. Any final advocacy advice for the rest of us before we leave the webinar?
Thank you very much for this opportunity. And thank you to all of the panelists. I've learned a lot about what's happening on the ground in various places. So I appreciate this opportunity to learn from you. I think we're now in a good place during this pandemic to collaborate and to help each other, because we all have similar thoughts, similar philosophies. I think, you know, the IDA report and the GEM report, it's all pushing the same things going forward. So I'm very optimistic about a post-COVID world, and I'm looking forward to working with you all.
Thank you so much to all of our panelists and all of our participants today. Inspiring words, I think, to end on as we all work together to take this forward during the pandemic and beyond. Just a reminder that the recordings and presentations will all be uploaded onto the website, and we will respond to the questions that we didn't have time to today in written form. But it just leaves me to say a huge thanks to all of you, and we look forward to staying in touch on this important issue. Many thanks, everyone.
Thank you.